Morgan is the communications chair of American Black Cardiologists. Thank you so much for being here with us this morning.
Thank you for having me.
I appreciate your time. You've studied how race and gender bias in cardiology affects women in particular. Just talk a little bit more about what you found.
So when we look at a number of things, for instance, the instruments that we use, we know that they have some built-in racial bias with the algorithms in the way that they were developed. So the pulse oximeter, for instance, where we check the amount of oxygen by placing that clip on the end of your finger, that works by light passing through the skin, and people with darker skin tones can block that light, so that reading can be inaccurate. We see the same thing when we're looking at forehead thermometers that also work via similar technology, and even spirometry, which is incredibly important during COVID, which measures your lung capacity. The software is built into that, which asks about different racial groups, and if you say that you are Black, it decreases your capacity by 20% automatically. So a normal score for a Black person can be 15 or 20% actually less than a white person, who will then be referred for higher therapy. So we want to take a look at all of these things when we look at gender, race, and equity as we move forward, because inherent in some of the tools that we're using as physicians are racially biased algorithms and software.
Yeah, that's really interesting stuff, because that's like baseline, the equipment that's being used without a lot of other things being added on. So let's talk about this. The American Heart Association has now partnered with Damar Hamlin from the NFL to promote hands-only CPR. The theme for this month is Be the Beat. How important to you and misunderstood do you think is that?
It's really important for us to look at this. We know that bystander CPR is incredibly important, and only 3% of our population is really trained in CPR, and even less if you look at minority communities. And yet, with every minute that goes by when a person who has collapsed is not receiving CPR or even defibrillation if needed, that decreases their survival by 10%. And when we say survival, we want people to come back fully and neurologically intact. And so we want that full opportunity. Every minute that goes by etches away at what that possibility will be. And these are very important, not only minutes, seconds. And it's easy for people to learn. Hands-only CPR, you can drop to your knees, place the heel of your hand in the middle of someone's chest, and begin to push to depress that chest. Try to position your shoulders over your hands, lock your elbows to get the maximum amount of pressure. Anyone can do it, and we want to make it as simple as possible and not intimidating for people to wait for trained medical personnel to arrive while those critical minutes are going by.
Yeah, critical indeed. And it's easy to say know your numbers, but what should we really be looking for or paying attention to when it comes to heart health as women, knowing that signs and symptoms of problems may be different from men?
That is such a great point. And we know when we look at some of our data that only 22% of primary care physicians even feel comfortable treating cardiac symptoms of a woman, and 42% of cardiologists, which is astonishing, but not when you do a deeper dive into it, because the majority of cardiologists are still men. We know that women have better outcomes if they're seen by female cardiologists than male cardiologists. And we know that menopause is also a critical time when heart risk increases for women, even though the symptoms of heart attacks may be different and more subtle. And not only may your doctor overlook them or attribute them to other things, you yourself may also attribute them. It may not be the crushing chest pain and shortness of breath that we often see on television or that is familiar to us. It might be something very vague, like fatigue. Who doesn't feel tired sometimes? Or lower back pain, many reasons to have lower back pain, or even jaw pain that you may attribute to a dental issue and take a trip to the dentist. So all of these are things of which we need to be aware, because as a woman ages, her risk also changes, and menopause is a specific area that has been understudied, very few clinical trials. We're absolutely taking another look at that with regard to hormone replacement therapy.
Wow, Dr. Morgan, I could talk to you all day, but I think we've definitely helped some folks out who have been listening this morning. Thank you so much for sharing with us.
Thank you.
Take care.